Hey everybody, welcome to HealthBeat. Today is a special edition and we're going to be talking about our patient testimonials. So I think earlier today, Dr. Hobbs and I were having a great conversation about a client that he had, and I said that it'd be a great idea to share with our viewers the experience that they had and how they were able to come out of that. So Dr. Hobbs, why don't you tell us about the case that you were telling me about?
Absolutely. I'm Dr. Barry Hobbs with Hobbs Pacific Chiropractic in Livonia, Michigan, and definitely want to introduce Dr. Bennett in his office first as well.
Yeah, Orient Family Spinal Center.
And Dr. Hink.
Yes, I'm Dr. Josh Hank with Chiropractic Integration.
So it's Casual Friday. This is a very fun and important part of our profession is to hear the testimonials. And as we know, the testimonials that we receive and hear back, there's no price or no payment that could pay for the results that we see. It's priceless. So we're here to help humanity, and if you're suffering, we would challenge you to look for answers and results. The patient that I had this week that we were talking about earlier is a upper 50-year-old male. He just recently was diagnosed with MS, multiple sclerosis. He was having a lot of severe headaches, a lot of disorientation, a lot of problems, symptoms, and went in and got an MRI, and they found out that he had the beginning signs of MS. And what's interesting is multiple sclerosis, the signs of MS are showing up years on the films before the first symptoms show up. So this guy was probably struggling internally, neurologically, with some misalignments and subluxation in his spine before the first symptoms started showing up. He came in, his wife is a 20-year-old sufferer, unfortunately, of headaches and migraines. She's been to a couple of upper cervical chiropractors, and the migraines, headaches have gone away. So she transferred to our office because one of our mutual friends decided to go off in heaven, and her husband was listening and seeing the results that she had. And he said one key thing to me. He wasn't understanding the MS concept in our work that we do, but what he said was, Dr. Hobbs, this is really interesting. When I tilt my head back, I get dizzy and I want to faint. And as we know, the weight of the head is the weight of a bowling ball that sits on a little 2 to 4 ounce bone, the atlas. So we performed a thorough examination, and we performed the same types of examinations in our office. And what would you do, Dr. Bennett, to examine that cervical spine there just in the same case that I had?
Well, I think the first thing I do is take a look at how they're holding themselves. Is their posture being altered? Did I take some thermographic imaging to see not only is the posture being altered, but is the nervous system being interfered with? Because one of the key parts about that is that we all know that the brain and central nervous system controls everything. In fact, in the 1990s, there's a gentleman that won a Nobel Prize because he found that there was the direct communication between the brain, central nervous system, and the immune system. For years and years and years, most conventional medicine thought that the brain and central nervous system and the immune system function as separate entities.
Right.
And now they know that it's not true, that there's a direct communication there. So if there is dysfunction or disafferentation, and disafferentation again is when incorrect signals are going into the brain from the spine, from the nervous system, sending wrong messages to the brain, then there is a miscommunication overall and a dysfunction in the immune system, which will lead to a dysfunction in the nervous system, which will lead to the immune system not working correctly, which is going to set you up for a lot of things, a lot of autoimmune things, because that's what MS really is. I mean, it's the immune system attacking the myelin sheath or the covering around the nerves and deteriorating, eating them away.
Right, absolutely.
So basically what you just said is that you take the x-rays to determine the structural position of that bone to see if it's irritating any of the nerves. And Dr. Bennett, I know you take x-rays too, but you were touching on about the thermography that you did to find out what's the functionality of the nerve system. So I know one thing in my office that when people come in, we got to distinguish the scientific value of both of those things. We could take a thermographic assessment of the spine, but it doesn't tell us the actual position of those bones. We also need to use the x-rays to determine those positions so we can get a better clinical picture. So I think that's part of how we can help multiple sclerosis or MS, is that we're really looking for the areas in the spine that may be irritated, but also seeing it, like you said earlier, Dr. Hobbs, we can see these signs much earlier before those signs even show up. So these are things that we see in current clients, with the subluxation in the neck, where the neck's off balance and is causing a distortion of that neurologic energy and that communication. that those sclerosic, those plaques start to build up. And like you were saying, you can see them on the x-rays plain as day.
Absolutely. You just reminded me of another patient practice member that we had years ago. She's diagnosed as MS too. And when she stays preventative on her schedule to come in and get checked, just like we typically do with our dentist, we go and get biannual checkups to prevent cavities. So we educate our patients practice members to come in and get checked for subluxation, misalignment, so you prevent problems. And she'll walk fine and she'll do fine. But there was a time about 3 years there where I didn't see her, and she literally came in with the walker, and I didn't recognize who she was because she had lost that function. So back to this man that we were talking about, he was evaluated and he was adjusted. And then we rest him, post-set the adjustment, so the muscles and ligaments that hold those bones and that alignment together can set in a new way. And I tell our new patients, it's similar to pouring concrete and then roping it off. So you want it to set correctly, or baking a cake and letting it set. And I know that you gentlemen do that as well, set the patients. And a lot of times another
You talking about the baking cakes part? Or?
Yeah, we bake cakes with our clients too.
I eat cake,
Yeah.
but I don't bake it too.
Great analogy. So typically, if it's a senior lady, I'll give that analogy. If it's a young man or middle-aged man like this guy, I'll give him that analogy. And what that does is that really sets the adjustment and allows it, instead of just getting adjusted and then walking out the door, it could slip back out because those muscles have memory. So if a spine's used to a position like this and all of a sudden we correct it, we want that to set.
It's the most important part of the adjustment. Honestly, it is. You know, we laid people down to rest after a correction to let their body just go back to the normal. I'm telling you, and I let them know, this is the most important part of the whole adjusting process, because right now your body's making the adjustments to the new position that we put your body in.
Yeah.
You know, if you get out there and you go right back onto the street, you're going back to your old ways, back to your old abnormal posture.
Yeah, and it's really interesting. I've actually had patients that were skeptical even about what we do, and having them come in and say, you know, that while they were laying there, that they literally could feel like their spine shifting,
Floating, yeah.
and they're like, it was the weirdest feeling, and they get back up and we recheck them neurologically and then recheck the leg length to make sure that, you know, the indicators of subluxation that I look for anyways are gone. And we do find indeed that those legs have balanced out,
Yeah,
and the indicators are gone.
Yeah. You know, Dr. Bennett was talking about the tables and things that occur every day in our office. Countless times, there are numerous patients who are on the table. And if they came in, let's say with the right hip problem and or a left knee problem, after the upper cervical correction, we put them on these tables to set their adjustment. Majority of time, all of a sudden the patient will go, Dr. Hobbs, this is weird. My right hip is moving and my left knee is tingling. And they think it's weird, but of course we know that we're opening up that central nervous system communication between brain and body. And your body is so smart, it's been there since you were connected. It knows how to correct and fix this. So I tell the patients, I'm like, that's your brain. That's that mental impulse talking to that body part that you were having problems with and symptoms with, and it's correcting it on its own, instead of us coming in with educated mind trying to manipulate and do something to it. So every time that somebody is on that table, not every time, sorry, majority of times, people will have these amazing results in their lower body from that upper neck adjustment.
Yeah, isn't it so profound? And like, go fast forward to the client that you're telling us about with MS. What happened afterwards? Like, where is he at now? What is he doing?
Yeah, so he's only had 3 corrections and he's been in the office 6 times. So the other 3 visits that he had, he didn't need a correction because we did the evaluation and his nerves were firing. There was no interference. So I'm not going to touch something that's not broken, you know, as the saying goes. But in this case, he didn't have a subluxation. He didn't have interference. And I told him, I said, holding does the healing, not always adjusting. It's the holding does the healing. So what happened was, after the first visit, he came in 5 days later and he said, Dr. Hobbs, my pain scale was a 7 or an 8 on a scale of 10, and it's down to a 2 or 3. It's still there a little bit when I tilt back, but I can go further, and it's not as frequent. Now this is huge because he had been suffering with this since January, February, and it's July in Michigan. So fast forward now, he's down to a pain scale of 1 out of a scale of 10, and we enjoy pain scales, but that's not what we're looking for. We're looking for functionality, and this man now is able to tilt his head back and not have that passing out sensation.
Yeah, that's huge. I mean,
What I like to think about with that, and I know we got a break for a commercial here, but what I like to think about is, like, sometimes we see those signs and those symptoms start to diminish But when you really think about it, you're seeing a disease process there that is being slowed or halted, which means a longer life, which means better life, which means better quality of life for what time we all have left. Because we all have limited time on this earth, So it's about having the best quality of life we have for the time we have. And that's life affected. I mean, it's huge. That's families affected. That's families impacted.
Yep,
And that's-
absolutely.
Yeah.
Yeah, and to close up here on this first segment, the impact that it has that Dr. Bennett was talking about, not only is this guy functioning better and feeling better, but socially, he's happy around the house now. He was starting to get depressed. He was scared to go out. He was afraid he was going to pass out. He thought that the MS was just literally going to drop him because of that motion of that head. And so now he's out in the backyard grilling with his wife now. He's happy at work now. He's on the computer all day. And he's not scared anymore. He's happy. And that's the drastic impact that he has just from coming in to get that corrected.
Yep. Awesome.
Great.
Well, thank you so much for sharing what that testimonial did for you and your patient. It was really exciting for me because, I thought about all the people that we were able to help too. So I think when we return from our break, we're going to talk more about our clients and how we were able to help them achieve health. See you soon. Welcome back to HealthBeat. Today we're going to be talking more a little bit about our testimonials. And here we have Dr. Hobbs and Dr. Bennett. And I think Dr. Bennett was talking something very interesting about some blood work that changed recently with one of his clients.
So we had this patient that's been with us for about 7 or 8 months, and she has a condition that basically what her condition is progressive and it's degenerative in nature since the time she was born, and basically it causes her muscles to die, essentially. And so, one of the things they look at when you have something like a heart attack is that they look at certain enzyme levels that would be elevated in the blood that is a sign that the heart is actually, part of the heart muscle is damaged or died during that, cardiac episode. So her blood levels were always really high for that protein because of the fact that, she was constantly, her muscles were continually degenerating. And she also had elevated liver enzymes due to this. Both of those were elevated. And we had noticed, her mom and I had noticed that she would function better, whenever she was, after an adjustment or whatever, that she'd start walking slightly better, and then and things would kind of go backwards when it was getting close to her being out of alignment again and needing to be adjusted. And so basically, to make a long story short, she had some follow-up blood work done, and what they had found was that the blood levels of the protein was now normal, and it was normally way, way above normal. And the neurologist was kind of freaking out about it because, she basically said, there's no reason why this should be happening. This is impossible to have happen. And the blood levels were completely normal along with her enzyme levels of her liver enzymes. So basically, like I was saying, is what that means essentially is that a disease process at this point anyways is at least halted or slowed way, way down because those blood levels are normal. And so, we look at that, how the body functions, and that's one of those cases that honestly, when that patient comes in, I'm thinking, I don't know what I can do to help.
Yeah.
You've had this since you were born, but it was also one of those times where, it was kind of one of those things, for me, it was sort of if you want to think of it that way, a spiritual experience, because it was kind of one of the things where I was instantly felt like, hey, it's not me that's doing the healing. Right. It's the body that does the healing when it's free and clear of interference.
Right.
And sometimes there's no limit to what the body can do. Right. And only we put limits on it because we start thinking that we're the ones that are actually doing the healing, and it's not.
Right.
That's why I tell people, they come in and say, well, what about this condition? What about this condition? It's not going to change how I treat you. Your diagnosis is not going to change the way I adjust the subluxation when there's neurological interference. Right. It's not going to change that at all because I'm not there's no specific adjustment for multiple sclerosis. Right. So. There's no adjustment for MS. There's no adjustment for ear infections. None of those things. It's an adjustment to remove interference that's causing the body to become dysfunctional. And then when that happens, the body does everything it can within its power to try to re-regulate itself, to try to go back to normal.
So how did the body re-regulate itself from this? I mean, Dr. Hobbs, what do you think?
Yeah, so what's interesting, Dr. Bennett said, when this case come in, and we have these cases, these extreme cases that really touch us, come because we see the back and neck problems, the headaches, but we also see the organic diseases or the diseases that have been there since birth. So naturally, we're taught once you have something, you have that. And we tell the patients, A, let's stop it from getting worse. B, it would be great if we have the body actually reverse that and regenerate it. And that even stopped you in that case because this patient had this disease forever. And you went in there, the way we're trained, listen, we're gonna analyze the subluxation in the upper cervical spine, the brainstem, the fuse box of the body. He found interference there, disrupting the signals from this girl's brain to her body. You adjusted it, and like you said, there is no adjustment for low back pain or sciatica or allergies, asthma, or in this case, the proteins in her blood that she was trained with her mother and the neurologist to follow, because that's what we're taught, go to the neurologist. What's interesting too is that the neurologist was disrupted because what changed? Why are these protein levels normal? This has never happened, and there was nothing that I changed as far as prescription. There was no diet change, correct?
Right.
There was no exercise change, correct?
Right.
They were doing the same thing until the universe
They got
had
the
sent them
nervous
to
system
you.
clear.
Exactly.
And it's funny because we were talking about the nerve system the whole time, and the neurologist somehow missed this, right? Because your brain cell is connected to every cell in your body through your nerve system. So how could this possibly happen? Well, in your case, this person came in and their nerve system just wasn't functioning properly. So their blood was just creating abnormal cells, creating abnormal levels, right?
And the
all of
muscles
a
were
sudden,
dying.
Yeah, the muscles were dying. And all of a sudden, you put her head on straight. She's walking normally now. And now her cells are getting the proper communication from the brain, right? And now those cells and those glands, which makes those cells, they start to work properly. And now they start making the proper cells again.
Yeah.
And now people with MS start getting better. Now people with, deterioration problems in their muscles are getting better. People with cancer are getting better. It doesn't matter what condition you have.
Right.
Just like Dr. Bennett says, it's about restoring the body's normal function, and the body already knows what to do.
Right. And it is a miracle because
It is a
the body
miracle.
is a miracle.
Right.
And whether you believe in miracles or not, there's unmet expectations that are met. But that this body is a walking miracle that we have. And you were able to unleash that beautiful mental impulse in this girl's brain down her spine to her muscles, and that innate intelligence, that inborn intelligence that kept her alive, started producing proteins to go to those muscles so she can walk.
And I think there's one big thing that we totally overlook sometimes. I think people overlook this. I think a lot of doctors overlook this. And I think we forget the power that the body actually has. And I think majority of the time is that most people are looking at a subluxated population. What I mean by that is they're looking at a population of people that are walking around with neurological interference going on, right? So that's a huge variable.
It's
You know, I
impossible to
mean,
get
that's a
accurate
huge
information.
variable. And so, anytime a patient says, well, the doctor told me this, is like, but they're also, remember, they're talking about a subluxated population. And then this is one thing I get, and I don't know if you guys, do screenings and health talks and things like that, but I always get people go, well, yeah, what's the chance that you're going to take your instrument and find interference? Pretty good.
Yeah.
Because here's the thing. If I went out and I said, we're going to go to a population of people that have never had a dentist, and people are 50 years old, what's the likelihood I'm going to find a cavity? Pretty high, because people don't know to get it checked, right? And so, so when we look at this, I think we forget that the human body was made from two cells. It was created from two cells through that innate intelligence that's present there from the very time of conception. If it was created from two cells from scratch, it can rebuild itself also, at least to some degree. Now, there is what we call limitation of matter, but it can definitely rebuild itself and do everything it can to try to rebuild itself. We forget about that.
Yeah. That's a very touching testimonial that you gave
Absolutely.
today, Dr. Bennett. And we're here to change people's lives, and the body is a walking miracle and extremely powerful. And whenever we come back after break, we're going to have Dr. Hink give his testimonial of the week, and we'll see you after break.
Welcome back to Health Beat. We're here again with Dr. Hobbs and Dr. Brian Bennett. And today I'm going to tell you about a testimonial that I had a couple weeks ago. I know you both talk very highly about the MS cases and the cases that you have with this muscle deterioration, but I have something of a very common scenario that comes in. I had a 62-year-old woman come in. Yes, she was 62, And she goes, we're sitting down and we do the report. I did a thermal scan on her back. We did her x-rays. And she goes, well, I understand all of this and how my nerve system's related to my healing, but I'm 62 years old. I haven't had chiropractic care in 62 years. Why should I start now? I'm still here, right? I'm still ticking, I'm still alive. So then I had to tell her about a story about an 83-year-old woman that came into the office. And this 83-year-old woman, when she came to us, she couldn't move her shoulder at all. And for 15 years of her life, so in her 15 years from 83, early 60s, she began to notice that she couldn't brush her hair anymore. Okay, so for 15 years, this poor woman could not brush her hair. After 2 weeks of coming to the office, she starts brushing her hair.
And that's important to a female.
Female,
to
yeah.
brush
Right,
her
yeah,
hair.
that's huge,
For Dr.
right?
Bennett,
No matter
for
the
Dr.
age.
Bennett and I, we don't
Yeah,
really
it's
care
not a big
about
deal.
Well, he's got no
Mine's not
hair
as
over
big of a
here.
deal.
But
I got tons. So
this lady-
I brush my beard too while I'm at it.
I would imagine you do.
So these
that thing
are-
looks like well manicured, Dr. Hank. I'm just saying.
I appreciate it.
It's
Is that a compliment?
It does
It is
look
a
great
compliment.
today.
It's very impressive.
So these activities of daily living are important, and these are
Yeah.
standards also in Medicare that they look at of things you can or can't do.
Yeah.
One of them is taking care of yourself,
Right.
your hygiene.
Right.
Right.
So this patient could not brush her hair.
She couldn't brush her hair, and then I asked her, well, what else can't you do? She said, I can't brush my teeth for very long. I got to keep stopping, taking breaks. I can't reach my hand over my head. I can't put my arm through the sleeve. All this stuff. And I'm like, okay, so I was telling her this story about this 83-year-old. I'm telling this 62-year-old woman about a story of an 83-year-old woman who after 2 weeks can now brush her hair. She can now move her shoulder comfortably. And she goes, she's crying when she comes to the office because she's like, Doc, for 15 years of my life, I couldn't brush my hair. I can brush my hair now. And these are things that young people, we take for granted. So I told this 62-year-old woman, I said, Mary, after hearing this story, would you like to be able to brush your hair when you're in your 80s? And she's like, well, absolutely. I said, well, what'd you come in here for? She's like, well, my shoulder's hurting. And I said, you see, that's the same exact potential. What you are now is your earlier version of that 83-year-old woman. And what we could do is we could try to stop that from happening or try to prevent that from happening. And the beautiful part of it is it doesn't matter how long you have been without chiropractic. The same principle, that healing principle inside of you is going to work no matter if you're a day old or 100 years old.
Yep. And typically the population will come in when there's something wrong because that's what we've been trained, that's what we grew up is when you have a symptom, there's a problem. And
Right.
we know the neurology of the body that there's always something going wrong inside before the first symptom appears. And even in cultural, the analogies would be heart attack, cancer. That stuff is happening before they find that in diagnostics. In exams and reports and test results. And it's common where somebody will get an exam, let's say in March, and then they get one in November and they'll say, well, I have cancer now. Well, it was probably there in November, but it wasn't at that level enough
Right.
to where
To
it
be
showed up in
detectable.
the test results.
Right,
Detectable.
And I a quote that I really love a lot is talking about that person. It's like, why should I start now? Or like almost as if it's been too late.
Yeah.
And I always say, the quote is the best time to plant a tree is 20 years ago. The second best time is today, right?
So true.
And
Chinese
so,
proverb.
and I tell my patients all the time, like, think about it from this standpoint. Okay, if you got a patient that, let's use all three of our cases as an example. MS, okay, MS, shoulder dysfunction, muscle deterioration. If you can clear a subluxation out and have the body start functioning correctly, and the body heals from that, think about the flip side of that, which is what happens in the body when a subluxation is present. Right. If you really think about that for a minute, it would scare the daylights out of you, and you never miss another appointment to get checked.
Yeah.
Ever.
Yeah.
Because you start realizing that you are setting yourself up, you're setting your body up to become dysfunctional. If it becomes dysfunctional, who knows what's gonna go wrong.
Yeah. Another analogy I use whenever the senior population, 60-plus-year-old, will call in and say, I've never had this before, or why should I come in? I give them an analogy of, well, you're a 1945 Chevy or Ford car, whatever you are, and here you are coming in to get your electricity fired up and get back in alignment. That's what we do as chiropractors. And it's like that old car that's never been in alignment or washed up, and it's clean, it's turned on, that power is turned on. Right. And it's amazing how that vehicle will drive and perform better. Well, the human body is much more mechanical and miraculous than that. All of a sudden, these things start happening. They are able to start brushing their hair, bowl, get up and down from the toilet without hurting. In that population, it's like not brushing your teeth for 60 years. This is your spinal hygiene, which controls your life.
Right.
All your organs are controlled by the nerves that exit the spine.
Even your teeth are controlled by those nerves.
This is more
should
important.
take better.
And the thing of it is, that's not a theory.
No,
It's not a theory. It's irrefutable.
Yeah.
Like it's not something that somebody come up with. It is irrefutable.
Yeah.
Happens
Mary,
every day in our office.
Yeah, Mary, you
Every
are
day.
62 years old. You've never brushed your teeth. You've never cleaned your spine. I can smell the halitosis, bad breath. And you are going to have
Yeah.
symptoms. There are things that are occurring inside there.
Right.
Absolutely, And I started talking to her. I was like, okay, so I try to create this like future for her, and I said, what we started to see, and I know you both see it in your office too, is that when people start getting corrected, their blood pressure stays down longer on average, their heart rate stays down longer on average, their energy stay higher on average. They just stay and feel healthier on average. So I said to her, look, at the end of your life, when time comes, and let's say you pass away, if you had one wish to just have even 10 seconds more on your life, my question to you is how much would you pay for that extra 10 seconds, right? Because it's huge. When people come to me and you get a correction, you start chiropractic care, you're going to live at least 10 seconds longer. I can give you that 10 seconds, and I promise you, it's not going to cost as much as you think it would cost. And it's not going to cost as much as you would pay, because that extra 10 seconds could be a goodbye to a loved one. That extra 10 seconds.
Yep.
And what's
Right, it's
interesting
huge.
is that last part of life, for those, I was in a hospital bed there, and they were keeping an eye on my organs, and my heart was in arrhythmia. The thing that controls our life is the brain stem.
Absolutely.
And you can have brain death, but it's the brain stem that once that stops, they'll say you're deceased. And that's the area that we work on every day, is to remove the pressure off of this brain stem in the upper part of the neck.
And doing it specifically.
Exactly.
And actually using objective measures to know that we have indeed removed the pressure, and that the body is now in a state of trying to rebuild and regenerate.
Right.
It's either doing one or the other. It's either regenerating or degenerating.
Right. So
There is no treading water.
Right. It's either improving or not. So,
Right.
and Dr. Hink is, not only was Mary, I'm sure, feeling better or functioning better, but I know that you had the
She's in
scans. that said-
jazzercise now. She comes in. She loves to be touched. She brought her husband in. So the impact is huge. It's affected so many people in her life. And just like our program today, I really hope that some of the testimonials that we were able to share with you have impacted you and provided value for you. So if you know of somebody that might be in your life, chiropractic is something that has a huge potential for them to not only help, but also transform their life to the level that me, the doctor, and even them didn't even have in store for themselves. So I would encourage you, please tune in next week for our next episode. Until then, don't do anything we wouldn't do.